So when we were looking at some of the ethics in CAR-T, we talked a little bit around outcomes. So preparing patients for realistic outcomes from CAR-T. Right now, of course, it's just over 40% of patients that do well with CAR-T and have lasting remissions. Other patients do not. They may respond initially or they just don't respond. And so we talked about making sure that patients are properly equipped for this. They have information around the realities of CAR-T, that it doesn't work for everybody. And right now we don't know who is the ideal patient, though there is research happening to try to figure that out. So that they know that when they have the emotional, psychosocial support ready for them to help them cope, but also they know if there is a plan for them after this, right? So what other treatment options are available? Can they go into another clinical trial? It's just making sure we're communicating all aspects of care to the patient, including setting them up properly for this kind of reality. When patients are not well informed in this area, again, it can be a real shock for them when CAR-T fails. It has been hyped in the media as curative, game changer, all kinds of words with it that are big and have huge impact. And for a patient who this doesn't work for, it feels like a really big failure, right? Patients are going into this with the expectation that it's curative. So we just need to do a better job from a healthcare perspective of preparing them for really what the outcomes are looking like in the real world. Again, we know that there's more research coming. There's different clinical trials where we see some different efficacy rates with different new CAR-T. But at the same point in time, most people are getting the products that are currently on market. And of course, there are limitations to the number of patients that actually respond positively with long-term remissions. In addition, we just talked about the need for making sure that it is a really well-rounded team that is supporting a CAR-T patient. It really is a therapy that takes a village to help a patient through. And so that obviously, it includes the people that are within the hospital center, your doctors, your nurses, hopefully some psychosocial support, your pharmacists, palliative care, and the importance of having them involved. Palliative care is not just for people that are dying, but also for helping people cope with the intensity of the illness that they've been through and making sure that they're living as well as they can through it. And again, pulling in external resources to help. Patient organizations can be an excellent resource in terms of education and support for patients. So how do we connect all of these different people together so the patient has the best experience they can? Finances always become an issue for patients because there's such a big barrier for many. Not even, I know people, when you talk about the cost, think that the financial issues are just related to the cost of the therapy. No, even patients that are in public healthcare systems talk about the financial burden of the therapy, the time off work for them and their caregiver, the cost of living near a hospital if necessary. All of those things add up. So it's not just an outlay of cash that's having that financial impact, but it's also the decrease in revenue for the family or the decrease in income that is also making a difference. So making sure wherever you can to have all of these different factors considered when you're working with your patients locally and helping them through all these different aspects of going through CAR-T.